Coming up next, what can you do to improve your brain health? One of the world's most famous psychiatrists joins us with his advice.
In a business world of information overload, we strip away the complexity and confusion to give you the essence of financial news. Pure value. Biz Asia America.
Our next guest has topped the New York Times bestsellers list an astonishing 9 times. He's been called the #1 neuroscience guy on the planet. As founder and medical director of the Amen Clinics, he and his staff have amassed the world's largest database of functional brain scans. The collection includes nearly 100,000 images from patients in 111 countries. He pioneered the use of SPECT scans. He believes his method of brain imaging can revolutionize the diagnosis and treatment of a multitude of brain disorders, including Alzheimer's, depression, and dementia. Though beloved by legions of loyal patients, he and his unconventional approach to mental health have not been without criticism. But Dr. Daniel Amen claims that in the future, not utilizing brain scans will be the basis for malpractice. Amen also claims that 77% of his patients who'd previously tried multiple doctors and medications had improved across all measures as a result of his SPECT-enhanced treatment. Here to tell us how better brains lead to better lives is Dr. Daniel Amen. Welcome.
Thank you.
Let me throw 3 words at you, which you've already thrown out there. Psychiatry is broken. Why is that?
Well, because I'm a double board certified psychiatrist, so I did all the right things to get trained. Psychiatrists are the only medical doctors who never look at the organ they treat. So think about it. Cardiologists look, neurologists look, your orthopedic doctor looks, gastroenterologist looks, everybody else looks. Psychiatrists still make diagnoses like they did in 1840 when Lincoln was depressed. So I love Lincoln because he failed, and then became a wild success. But he suffered with depression. And in 1840, in the winter, he went to see his doctor, Anson Henry. And how did he diagnose him with depression? He talked to him, looked at him, and looked for symptom clusters. That's exactly what happens today when we have had technology that can enhance diagnosis and treatment for at least 23 years.
But you could be stuck back at 1840 if it wasn't for this chance encounter. Dr. Jack Paldy, you watch this presentation and you're thunderstruck. Talk to us about what happened then.
So it's 1991. I'm a psychiatrist. I'm the director of a dual diagnosis unit. It's a psychiatric hospital unit that takes care of drug addicts. And I just go to grand rounds at my hospital, and here Dr. Paldy is talking about brain SPECT imaging, that it gives you more information to help your patients. And that's always my goal. My goal is always, how can I help my patients get better faster? And I'm like, well, of course I should look. Why wouldn't I look? Everybody else looks. And, you know, when I became a psychiatrist, my dad asked me why I didn't want to be a real doctor. And it sort of hurt my feelings. But 10 years later, I began to understand because we weren't acting like real doctors that actually evaluated the function of the organ you treat.
So once you started looking at these images, what happens next?
Well, it just revolutionized everything I did. I realized depression is really not an illness, it's a symptom. And that treating everybody with depression the same, giving everybody Prozac, is like giving everybody with chest pain the same medication, which is just stupid. So there are many different causes of ADD, anxiety, depression, autism, addiction. So that was the first thing. The second thing we learned is that mild traumatic brain injury ruins people's lives, and nobody knows because they end up seeing psychiatrists who never look at the brain, so they don't know it's that car accident, it's the concussion playing football, it's falling off of a ladder that is really causing behavior problems. So that was the second thing. The third thing, I looked at my own brain and I didn't like it, and I realized and I'd been doing this with my patients, you literally can change their brains. You're not stuck with the brain you have. You can make it better. And that's what drives me, is making people's brains, including my own, better.
Well, you're talking about your own brain, so let's take a look at it, because we have scans from when you were 37 and 57. Talk to us about what we're looking at.
So these are two SPECT scans. SPECT looks at blood flow and activity. It looks at how the brain works. And if you look at the image on the left, that's my brain in 1991, and it's bumpy. And I'm like, why is my brain so bumpy? I don't drink, I don't smoke, but I had a lot of bad habits. And I had meningitis when I was in the Army. I developed this concept I call brain envy, where I really started to care about it. And I started to take much better care of it. I got better sleep, took some supplements, ate better, exercised. 20 years later, my brain looks younger than it did when I was 37. Now, I'm excited about that. We did a study with 8,000 people, 8,000 brains. And what we saw is over time, the brain gets less and less active. So sort of like as you age, your face begins, the skin begins to fall off your face. The same process happens in the brain, but we realized it doesn't have to if you do the right things.
And so the right things, let me talk to you about the right things, because let's just take you at 37 versus 57. People today are going 100 miles an hour. People don't work 40-hour work weeks anymore. They've got a device in their pocket. They're on call. They're answering emails all the time. We're constantly working. We're not getting enough sleep. So we wake up in the morning. We got to start caffeinating ourselves to death. We got to grab that quick bite to eat. We don't eat like healthy. I mean, you're hearing what's actually happening out there. How do we change all of that? Because the dimensions aren't going to change. Our life isn't going to change. Or can we change that?
Well, it's three things. The first one is brain envy. You have to care. See, Freud was totally wrong with penis envy. It's the wrong part of the body that you really need to care about. It's the space between your ears. So the first thing is care deeply about the health of your brain, because it controls everything you do, how you think, how you feel, how you act, how you get along with other people. So care, brain envy. The second thing is begin to avoid anything that hurts your brain. So for example, 1991, I'm about 30 pounds overweight. And I had no idea. There are 200 studies now that say as your weight goes up, the actual physical size and function of your brain goes down, which should just scare the fat off anyone. And when I read that first study, I lost 30 pounds. I mean, I only tried to lose the 30 pounds for about 30 years, tried every diet you can imagine, but I didn't really care that much. Now all of a sudden I'm motivated because I don't want to have a smaller brain. I actually coined a term called the dinosaur syndrome. You know, big body, little brain, you're going to become extinct. So avoid things that hurt your brain. So being overweight, smoking, that sort of makes sense. Drugs, alcohol, it's not a health food. It decreases function in your brain. Having a high blood sugar. Did you know that diabetes actually triples the risk of Alzheimer's disease? But even what we know now as high normal blood sugar is associated with brain atrophy. So I talk about eating smart carbs, which is low glycemic, they don't raise your blood sugar, high in fiber. So I'm not opposed to carbs, I'm just opposed to the ones that give you dementia. Not sleeping. If you get less than 7 hours of sleep at night, you have less blood flow to your brain, which means more bad decisions. Sleep apnea, really important. People who snore loudly, stop breathing at night, tired during the day, that oxygen debt can really damage their brain. So brain envy, you gotta care. Avoid anything that hurts it, including hitting soccer balls with your head or playing tackle football. We did the big NFL study. I mean, you just have to stop lying about the issue. Playing football is a brain-damaging sport. Okay, so brain envy, avoid bad, do good. So which is new learning. So in your job, you're always learning, interviewing, learning new things. That's critical. People who are in jobs that do not require lifelong learning have a higher incidence of Alzheimer's disease. So like you should exercise 20 minutes a day, it's also important to exercise your brain. 20 minutes a day. So new learning, the right diet, exercise, but a very specific kind of exercise. I like weight training because the stronger you are as you age, the less likely you are to get Alzheimer's disease. And burst training. So I hate marathons. I'm just not
I'm
a
with you
fan.
there.
It's too much stress. Chronic stress kills cells in the memory centers of the brain. You know, the guy that ran the first marathon was actually from Marathon, Greece. They won a war, and he ran 26 miles to Athens and said, "We won." Then he died. So why would we ever do this on a regular basis? So exercise, but not crazy exercise. I particularly love coordination exercises, dance, and my favorite is table tennis. Got to get your eyes, hands, and feet all to work together while you think about the spin on the ball.
Talk to me about the blood flow in the brain. Why is that so critically important?
Well, a lot of people don't really get how special the brain is. It uses 20 to 30% of the calories you consume, so it's the most expensive real estate in your body, and it uses 20% of your blood flow. So any blood vessel problem, so heart disease, atherosclerosis, high blood pressure, is damaging your brain. And it's also why, you can tell the skin of a smoker, more wrinkled, more discolored. It's doing that exact same process in your brain. So like you should have brain envy, you should have blood vessel envy. You really want to keep your blood vessels working right, which means lower stress, don't put anything toxic in your body, and exercise.
SPECT versus MRI or some of the other imaging, why is it more important?
Well, SPECT is a group of a number of functional studies. And in psychiatry, so anxiety, depression, ADD, addiction, the structural studies like CT or MRI are really not helpful for us. It's the functional studies. We really like SPECT for a lot of practical reasons, one of which we have nearly 100,000 of them. So when we look at a scan, we really understand what it means.
Let me throw this at you because I know you've heard the criticism. There was a Washington Post article in 2012, and it says that Daniel Amen is the most popular psychiatrist in America. To most researchers and scientists, that's a very bad thing. And I'm sure you read that, and it probably hurt your feelings. But what are your thoughts about the critics out there? Why what you're doing is bothering people in the field, would you say? Is it because it's different, or
Well,
why
I
are
was
they
actually
embracing it?
fairly irritated with Neely Tucker, who wrote the article, because we've had 5,000 mental health professionals refer patients to Amen clinics. So it's really not true. Now, what we do is very controversial. Why? Because you have this whole field that's not looking at the organ that it treats. Now, most people don't like to be told what they're doing is wrong. And I don't really like telling them that, but that's the truth. When you don't look, you hurt people. You miss really important things. So I'll tell you a story. So there's a girl by the name of Adriana, and she lets me tell this story. She's 16 and she's normal. And then her family goes to Yosemite on vacation, and they're all excited. And when they get to their cabin, they're surrounded by 6 deer. And to them, it's a magical moment. But 10 days later, she starts hallucinating. She becomes aggressive. They have to hospitalize her. So now she's in a psychiatric hospital unit. 3 different antipsychotic medications, they don't work. Months later, she's a shell of herself. So she's seeing psychiatrist, more medication. She comes to us and we look at her brain, and it's like her brain's not right. We need to find out why it's inflamed. She has Lyme disease. And on an antibiotic over the next year, she got her life back. And she's now going to be a senior at Pepperdine University. So without looking, you wouldn't know what's the right treatment, and you condemn someone to, the psychiatric hospitalization medication rabbit hole that devastates people's lives. And I'm not okay with that. And, if my critics don't like it, it's like, well, I don't really care because I don't work for them. I work for the patients who come to Amen clinics.
Let me kind of riff off this because I recently read an article, it was a piece Dick Cavett did on Robin Williams and his death and depression. And he said in it that, he was diagnosed in the 1970s, and this famous psychopharmacologist that he knew. He went to him and he said, man, there must have been incredible advances from when I was diagnosed to today. The guy said, not really. And you know, to think about you and how far you've gone as an ARC, and you probably, I bet you could go back to 1991 and find a lot of psychiatrists who are still doing the same thing that you were doing then before you had this aha moment. Why is the business stuck in many respects?
Well, because our diagnostic paradigm is wrong. So the American Psychiatric Association, and I've been a member for 32 years, we're stuck in this DSM Bible. So we have a book called the Diagnostic and Statistical Manual that's basically the cookbook of diagnosis. And it says if you meet 6 out of these 9 criteria, you're depressed, or you have ADD or bipolar disorder or whatever. And we're making diagnoses without any underlying biological information, which is just crazy when you think about it. And it's like, so what's the argument with more information? And we've actually held debates at the American Psychiatric Association, and we murder them because it's rational. Most 9-year-olds would understand. And yes, I mean, is it a perfect tool? Absolutely not. Do you have to talk to people to get a right diagnosis? Absolutely. You have to talk to them, look at their brain. But when you do, it gives you so much powerful information. But it's changing. I mean, for example, they do our imaging work in Vancouver. They do it in Toronto. They do it in Denver. They do it in Chicago. So outside of the Amen Clinic, there's this group, and in the Washington Post article, they talked about it, that I'm not the only sort of person doing this. I just tend to be the loudest.
You're the target. What about patients? What are you seeing? Because I mean, you must see their faces afterwards when they see the imagery, and then just trace it, to actually look at the brain. And as you did here, 37 to 57, maybe it's not 37 to 57, maybe it's just 3-4 months they can see a change. What are their reactions?
Well, you know, it's one of the things that hooked me early on. I mean, my first patient I ordered a scan on, I knew she had ADD. I mean, you know, I'm also a child psychiatrist, so it's one of my specialties. She's a 40-year-old woman, tried to kill herself the night before. But then about half an hour, I know she has ADD, but she doesn't want to hear it, doesn't want treatment. I said, well, can I look at your brain? She's like, okay. And we did it twice, once at rest, once when she concentrates. And when she tries to concentrate, her frontal lobes dropped in activity. And so I put the scans on the table in front of her in the hospital room. And as I started talking to her about it, she started to cry. And she said, you mean it's not my fault?
Wow. Wow.
And I said, yeah, having ADD is sort of like people who need glasses. You know, people who need glasses aren't dumb, crazy, or stupid. Their eyeballs are shaped funny. They wear glasses to focus. People have ADD aren't dumb, crazy, or stupid. Their frontal lobes turn off when they should turn on. This will help you. And I knew that, but the images completely changed everything for him. Decrease stigma, increase compliance, develop brain envy. Now I have someone who cares, and now it moves the partnership. Or I had a patient with schizophrenia. No way he was taking medication. He saw his brain and he's like, can you help me? And it changes everything from, you know, my own life personally. If you date my daughter for more than 4 months, you have to get scanned. So it changed my children's life.
That's probably a good thing. I've got a daughter. I may have to recruit you for that. What about the overmedication of America and maybe perhaps the world? I mean, my daughter, when she was going through high school, I swear almost every one of her friends were on Adderall. Everybody had ADD. Is that a real problem out there, do you think?
ADD is a very serious problem. And when left untreated, it devastates people's lives. 35% of them never finish high school. 52% untreated ADD have problems with drug and alcohol abuse. Triples the risk for Alzheimer's disease because it goes with all sorts of other things like obesity and diabetes. But it's not one thing. Adderall helps some people, hurts other people. And there are many natural things to try first.
You work in a field, though, that one of the things I always say is if you go into the doctor, you've got a cold, you feel okay about going and talking to them. But a lot of people don't want to acknowledge, as you pointed out, they don't want to acknowledge that they've got ADD, or they don't. There's this stigma out there. How do you erase the stigma when it comes to these issues?
Well, and you brought up Robin Williams earlier. I've thought a lot about that since his suicide. Nobody wants to see a psychiatrist. Nobody wants to have a mental illness. Nobody wants to be defective. But all of us want a better brain. So what if mental health was really all about brain health? And that's what the images have done for me. When I show them to a patient, they go, oh, I have a medical problem. It's not a moral problem. And then they get excited about eating right, exercising, supplements, or medication, because it's all about optimization rather than stigmatization. Now, we do a lot of work in China. I've actually spent 8 days in Hong Kong. And so one family sent us 40 patients to our Costa Mesa clinic from Hong Kong. So I went over and gave a series of lectures. And it's a shame-based society when it comes to mental illness there. You often don't see patients until they're really, 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 really sick. And what we're trying to do is change the messaging, that it's really not about you're defective, let's fix you. It's you're not as good as you could be. And I think Asian cultures really understand that. It's how can I be my best? And that's what I get excited about. It's not calling somebody a bad name, you have a personality disorder. It's how can I optimize your brain so you can be a better dad, you can be a better mom, you can be more effective at work, you can live longer, more energetic, healthier.
Dr. Daniel Amen, thank you so much. I'm going to cut down on the coffee. You talked me into it. I've got brain envy too.